And you're gathering this information, but then from a sociological background, you look at it and you're like, well, there's a lot of different sociological aspects in terms of the ways of thought, the ways in which we take care of ourselves, maybe from a very Jamaican background. And then you look at the diversity within the Jamaican population, and you look at that and you're like, okay, well, maybe Afro-Jamaican men have a different perspective on prostate cancer or taking care of their health or what health means, while, versus other populations. So that's what I find, that the benefits of my background is that even though I understand the data and I understand the objectivity of what it means to be like a scientist or a researcher, I also kind of pull it back and I'm like, okay, well, let's look at the sociological aspect of it. Let's look at what's really going on. What are people saying? How do you relate to people? How do you understand their behaviors? In order to make more informed decisions when you're actually making policies and programs to, help the populations.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 40. Hi everyone, Omari Richards here. Thank you all for joining me today. I hope you all are doing great, having a great time, taking it easy. Today's episode is a great one. I enjoy the insights from this person who I think is the first person I've spoken to who's gone to school in the UK, which is kind of cool. Accelerated program, which I didn't know about before, but just a fascinating interview, and I hope you all enjoy. Definitely subscribe, like, leave a review, share this with a friend. Appreciate you all. Without further ado, enjoy this episode. Today, we have a public health professional who's passionately curious. She has a bachelor's of science in biology, ecosystem health, and a minor's in women's studies. She got her master's of science in gerontology at University of Southampton. She's also getting her certificates in health studies, public health at Ryerson University, and a certificate in improving global health at Harvard University. She's currently a freelancing health and social policy researcher for DiversityTalk. We have Ika Washington, MSc. Welcome to the show, Ika.
Thank you for having me.
Yeah, it's a pleasure. Like I know we chatted. Well, I was saying this before the show. We chatted like a year ago, and you were like one of the kind of people that I spurred me on to making a podcast just from like reaching out to people to connect to. So I thank you for that serendipitous moment that kind of helped me get this solidified in my mind.
Of course. I'm actually so happy that you've actually, taken the jump to do it. So congratulations on that.
Thank you, much appreciated. So how are you doing, and how have you been coping during these times?
It has been a lot. In the beginning, it was really slow. It's trekking along. And now I find myself a little bit overwhelmed, which I feel like a lot of people within our industry is right now. There's just a lot of things to do and a lot of things that we're passionate about as public health professionals. And so, just have to keep moving and just remember that the work that we're doing is actually benefiting people as well as communities. So
Yeah, awesome. And so how do you identify, and then tell us a little bit about your personal background?
okay, so I will say that I identify as a Afro Jamaican woman. My pronouns are she and her and hers. And currently I have multiple positions that I do, but I'm currently working as a project manager on with the Black scientists on vaccine equity. There we go. And also, I work as a public health analyst as well as a regional rapid testing coordinator for the Sioux Lookout First Nations Health Authority. A lot of my jobs are consultancy based, freelancing. So whenever I'm called on a project, it's usually project management based or very much like in an analyst position of writing, report writing, researching. So.
Okay, awesome. And I definitely look forward to digging into that a little bit more later on. So what does public health mean to you?
Public and health. But for me, it's more about, I look at it more of the health equity aspect of it, the access, the delivery. When you're looking at the public, I look at a lot of the vulnerable populations and the individuals that kind of get overlooked. When I think about healthcare, I think about well-being and quality of life per se. And I also look at myself as well as the people around me in terms of personally and what I would want when I'm in that position and having that allyship and that empathy when I look at public health. But it's mainly about access, delivery of care, and also accountability from, where are my tax dollars going towards? Because essentially in Canada, although healthcare is free, it isn't really free. So, yeah.
Okay. I guess just before we dive into this a little bit, like, what's your background in, like, you said you're Afro-Jamaican and now you're in Canada. So tell me a little bit about that before we get into anything.
Ooh, identity. Okay. So I find and I weigh personally my ethnicity as well as my race before my nationalism.
Mhm.
So even though I am born Canadian, my parents are Jamaican, born and raised in Jamaica, but even my upbringing was all about Jamaican and being a Black person, and that's what I identify with first is my race and my ethnicity. I feel like it has structured how I navigate my spaces, who I am as a person, and then just being Canadian is the icing on the top, where I'd be able to get the advantages, the political advantages of being a Canadian citizen. But in terms of my identity, it's who I am. It's, in terms of my culture, my beliefs, my morals, and just even how people see me. People see me when I leave Canada as a Black woman and a Jamaican woman rather than just a Canadian, because that's what my passport is. So, yeah.
Okay. Thank you. Thank you for indulging me in that. So you got your Bachelor's of Science in Biology and Ecosystem Health and a minors in Women's Studies at Western University. So what was your thought process for going into this degree and getting it?
I didn't have a thought process in the beginning, and I'm going to be completely honest with
Mhm.
everyone. When I got into Western in my first year, I was in the biomedical program. And to be honest, I never really enjoyed it. It wasn't the type of science that I had wanted to get into or what I thought it was going to be. I went into the university thinking, okay, I'm going to be a doctor, and that's all I'm going to be. And I think a lot of students go in thinking that as well. But essentially, you get introduced to so many different things and different aspects of science, and slowly I started shuffling into just going into biology because I realized that when it came to my grades, biology was always the highest. I was not good at chemistry. I'll be, you know, as honest as possible. And physics it was there, it was trekking along. But when it came to bio, it was just my forte. I actually ended up in women's studies by accident. And that was because I ended up needing to take a minor, like one of those like those credits that you needed to take that
Mhm.
wasn't within your program. And women's studies was the only courses that were available in terms of a bird course that they call it. And I ended up taking the bird course that ended up taking my minor degree because women's studies at the time at Western was very much focused on feminist theories, but feminist theories based on looking at the ways in which our society has, in terms of inequalities, inequities, structural and injustices, and having that voice. And it was there that I found my voice for advocacy. And that was where I started to learn about theories like intersectionality and also critical race theories and how that actually played a part in my life as a Black woman, but also played a part in biomedical approaches and structures. And from that, I found that, a lot of it conflicted with the science background that I have in terms of what our approaches are sometimes, and also with the approaches of women's studies. And, putting those two together, I found was really good. And that's how I ended up in, what I do now as a public health professional.
Okay, and talk a little bit about like what you find in those conflicts between like what you thought it would be and then what it is and what you like want to do in your work.
Yeah, no. So I found that the conflicts of science is that when you look at a biomedical approach, it's very subjective, objective, excuse me, very objective. It's, A plus B equals
Mhm.
C, for example, when there's a lot more that goes in between, there's a lot more to explain. So like when you look at mixed methods approaches and you look at triangulation and you're trying to find out why do these things happen to certain populations or why do certain things happen, it can be understood from both like a sociological background, and I find that is mainly approached. So like when you look at healthcare now, and I sit down and I'm like, okay, you look at the rates in Jamaica in terms of prostate cancer, for example, and from a very very straight science background, you're going to be like, well, guess what? Jamaicans are not going to the doctors, for example. Don't hold me to it, but like for example, Jamaicans are not going to the doctor because they have low, health utilization rate. Or you're looking at, you're just like, oh well, the populations are too remote, and you're gathering this information, but then from a sociological background, you look at it and you're like, well, there's a lot of different sociological aspects in terms of the ways of thought, the ways in which we take care of ourselves, maybe from a very Jamaican background. And then you look at the diversity within the Jamaican population, and you look at that and you're like, okay, well, maybe Afro-Jamaican men have a different perspective on prostate cancer or taking care of their health or what health means, while, versus other populations. So that's what I find, that the benefits of my background is that even though I understand the data and I understand the objectivity of what it means to be like a scientist or a researcher, I also kind of pull it back and I'm like, okay, well, let's look at the sociological aspect of it. Let's look at what's really going on. What are people saying? How do you relate to people? How do you understand their behaviors? In order to make more informed decisions when you're actually making policies and programs to, help the populations.
Yeah, I absolutely agree with that, and I think it's vital to, because I feel like that's the perspective of like having just a science, or like a very quantitative background, instead of diving into listening to stories and anecdotes and different things like that always carry like a lot of information, and sometimes, or a lot of the times, capture information that can't be captured in like the quantitative side of things. So I think it's just so interesting to think of that, and I feel like we have to continue to push and advocate for those, that kind of like knowledge collection and data and things like that. So appreciate you sharing that. um so were there any other big takeaways throughout your Western university career?
In terms of actual academic, I found that in the beginning, I was very discouraged. You kind of go in thinking you know everything or you can handle it, and it's sometimes that's not exactly what it is, and things are not really what they seem to be. So when I went into biology, I thought it was okay, everything about animals or something, and then I found out that was zoology. And you had like genetics and you had biochem. So you have to go in with a very open mind, and that's what I tell people. Like I ended up in ecosystem and health. What is ecosystem and health? A lot of people don't know what that is, so I will be here to explain it. It is basically just really integrating both the aspects of ecosystems, and nature, and understanding that with actual human health. So even in that, there was so much intersectionality, where it was like I was figuring out, I was doing chemistry on the environment and the ecosystem, but at the same time I was relating it back to, this is what pollution could cause in terms of, you know affecting human health. And so I ended up in a program that people don't ever know or hear about. It's still a very new area of biology, but just be open to understanding and looking at different ways and like different places within science, and don't just keep narrow minded. Being a scientist, you have to be open minded. You have to think outside the box a lot. Things are not necessarily thrown at you. So, that is my advice as people are going in. And that's something that I definitely learned, that, you can be a doctor, it's fine. Nobody, but um, look at other things. It may draw your interest. And it may just come easier. I found that it came way easier than when I was taking genetics that I dropped.
Yeah, and I bet that became easier than the chemistry too.
Oh God, yes. Oh yeah.
Yeah, I know those kind of struggles, but I definitely feel you there, and I think that ecosystem health sounds similar to like One Health, or at least that's what they call it in the US, where you focus on what is it, environment, humans, and animals.
Okay.
And I think that that's a model that should be like the model that we have everywhere, because as we see it right now with climate change and everything, like if we don't center environment and like we just, okay, I don't have to explain anything, but yeah, we know how bad it is. But anyway, so going after Western University, you went on to get your Masters of Science in Gerontology at University of Southampton. So talk to me about the process for well, the thought process for choosing this.
The thought process was like, I have to get my master's because I like to talk. That was a thought process. But in all actuality, I started actually in the between, and I guess we'll talk about it. I started working in the cannabis space. I found myself really into naturopathic medicines and understanding the beauty of plants and how it can actually be a positive impact in terms of healthcare and the ways we see healthcare. And throughout the time, I was seeing like the people that I wanted to that I was working with and the ones that were doing the research, and I was like, okay, I definitely have to get a master's, just because I felt like I wanted to really enrich the experience in terms of my education. Um, so I ended up doing my master. I ended up like, okay, applying. Canada didn't work out for me really. It's very, very hard process sometimes at least I found it very difficult. There wasn't a lot of spaces as well in gerontology, which is about aging. And I found that, the UK was a little bit more advanced when it came to older adults and understanding aging and life course and stuff like that. And I was like, why not move to England for a little bit? Because I've been moving all of my life, most of my, in my 20s. So I applied. It was a very, very easy process. So if anybody is really looking to go to the UK to study, I definitely recommend it. It was a great experience. The teaching is very, very different than from the Canadian perspective. I'm not too sure about the American, but from what I know, it's a little bit different. It was very much more critical thinking. It was very much on the application of thinking in terms of the things that in terms of theory and bridging that. I think that's where they focus really is the bridging of theory into practicality, which I much enjoyed because as much as I'm a theorist, um, I like to apply the theory. Um, and I found that, and I specifically chose University of Southampton because it was one of the Russell Group universities, which is a really high ranking research institutes in England, which is I think about 20 of them. And under that group is also Cambridge and Oxford, as well as King's College and a bunch of them. And also the professors at the time were doing a lot of work in dementia. They were leading researchers as well. So I was like, okay, perfect place. I got accepted. I moved over there for a year. And also, it was a year program. So if anybody doesn't want to waste their time, sometimes it is an accelerated program, 1 year, and you get everything you need. They equipped you. Like it is amazing what I've learned and the person I've become in just a year. And throughout the process, I love it. I can't wait to go back. I miss England now that I'm back in Toronto. So yeah.
Okay, okay, awesome. So I guess firstly, why what is gerontology and then why gerontology?
Okay, so I won't give you a Wikipedia answer. I'll give you my answer. So gerontology is a study of aging and older adults, as well as looking at older, like the life course. That's what gerontology is. Throughout that entire time, I did a lot of focus on where we are in terms of a population and understanding the ways in which our social, our environmental, as well as any other aspects, political influences have on our life course from birth, from conception, all the way to death. And understanding the ways in which we need to interact in order to make people's lives better in terms of quality and their well being of life. So we looked at things like war, for example, and the impacts of war on someone's life course and how that can ultimately end up derailing, well, not derailing, but having a positive or negative impact on someone's life in terms of like healthcare, mental health, the ways in which they interact, even how looking at the aging population now that we have and realizing that we may not have so many people in the labor market due to the decisions of older adults when they were younger, not having so many children or just the societal like familial structures are changing, and looking at maybe the trends of as to why that has happened, where has our political systems have influenced it. So it is way more than just looking at old people in palliative care and hospice, and it's way more than pensions, it's way more than dementia. There's so many different aspects of it. So I know for my dissertation I did it on the use of cannabinoid therapy, so cannabis, on older adults, and also using it throughout the life course and seeing the benefits of it. Um, of course, I couldn't do it I couldn't do like an actual like cannabis trial just because of UK restrictions on cannabis. But I looked at critical literature, and comparing that to see if it is. And I can honestly say it does help. So just,
Just putting it out there.
just putting it out there.
Awesome, thank you. So I don't know if you stated, but like what drove you towards like gerontology? Like why this out of like all the other things that you can go down the path of doing in life?
So I picked gerontology just because I know that we have an aging population. And again, as a Jamaican, I also looked at the people around me in terms of my parents' family, and my parents, my family, the family friends we have. And I realized that people are aging. And I realized that a lot of the decisions that they made in their earlier life is ultimately affecting them right now in terms of their health. And I realized that there is a lot of disparities in terms of the way that health is understood and how the education of health. And I was looking at how can we bend, like, even though they've made those mistakes in their past, how can we help them in the future? And I realized there's just a gap. There's not a lot of gerontologists, especially within North America. There aren't a lot. A lot of them are in Europe, and and they're doing their work there, and also Japan, just because they have a larger population at the moment. But we're slowly getting there, and I realized that there was nothing really in place necessarily that is there to protect the general population as they get older, but even particularly nothing to protect Black older individuals. And as you go and you just kind of break down to like Black LGBT, or you look at Black people that had long-term health issues, and you just keep breaking it down, there's like really not much in terms of advocacy and protecting them as they get older. And I was like, okay, well, I found a space and I'm gonna make use of it, so why not? And like I said, the professors in the program, the school was amazing. So that even pushed me towards it, to be honest. On my first day of my class, and when we got introduced to the professors, I was like, I still didn't really understand what gerontology was. And then when I started hearing the things that they were doing, like one professor was working in Indonesia, and she was doing looking at intergenerational, like the families and how family, like the support and all those things. And I'm sitting there like, wow, I didn't even know people do research on this. I didn't know that it was a thing to send money at Western Union, and it is a research study. Like, so you look at these things and you're like, wow, but it's such an impact on, the ways in which we understand aging and the way we understand, our places in terms of health and well-being. So yeah.
Okay, I will appreciate you sharing that. So talk a little bit about the transition from Canada to the UK. What was that transition like?
It was a lot. I did it by myself, and I'm so proud of myself. But the transition was a lot. The culture, thankfully, they speak English. Okay, thankfully, even though I didn't understand sometimes what they were saying, and they didn't understand me either. It was good. It was a great transition. It took a lot of having, you can't prepare yourself necessarily to move to certain places. It doesn't matter where you move. There's some things that you just really cannot prepare yourself for. And I found myself, thanks to the school had a really good transition and had that in place. And I had friends that I met off social media that were from England as well, that were really helpful in the process. But getting used to London and England, and going on the other side of the road, and I was always on the other side that I'm not supposed to be on, and it was a lot. But I think throughout the entire process, it was more of like understanding the money and understanding the different dollars, understanding where to get, how to get a bank account, and um, there's a lot of differences, but there was a lot of similarities too. And I think that's a benefit of being a Canadian citizen and going to England, is that there are a lot of things that we do have here that may be a different name, but it's the same, really.
Okay, okay, and and I want you to talk a little bit about your accelerated program. I didn't realize that your master's was an accelerated program. So how like was it like very rigorous? And like what what do you take away from like it being like accelerated?
So accelerated was, we actually didn't have much exams. We had It was all written assignments, and we were given the written assignments well ahead of time, so at the beginning of our semester, and they were just kind of scheduled. And it was a variable of different type of writing styles that they really tried to implement, which was like, critical writing, opinion pieces, literature reviews, research, like heavy research projects as well, demographic reports, all those different types of reports that you can think of. I've written every type of tone you can think of during that entire process. But it was like a lot of like, it was really spaced out in terms of the type, like, so you would have like a bunch of different programs that would kind of run concurrently that were the same type of like, themes and stuff like that, and you just have to like write a bunch of reports on it, and given on different topics. And then during the actual lectures, our lectures were very spaced out. They were very gracious with that, which I was surprised. Which is one thing that they were really good at, was having that work to life balance. Like, even though you were doing grad school, everything was very work balanced. So it was like, okay, you have 3 days of the week where you don't have any classes, but you have to make sure you're doing your research, and you are given like a personal tutor who you'll meet with during the week. Just because there's so much assignments. So at a given time, you may have like 6 assignments to get done that are staggered between 2 weeks. But unlike me, I do everything last minute. So I don't advise anybody, if you're going to England, don't do your assignments last minute, because you'll be writing papers back to back to back to back to back. But that's what I meant by accelerated. And then our research project, which is our dissertation, that was done in 4 months, 4 months, I think. But you got some prep time, but the actual writing process of it was about 4 months. So it was super intense that entire summer, of having to just sit down and be like going through data, working with your supervisor back to back. And it really pushed you to be an actual researcher, where you're managing your own project at this point. Like, everything really counts on you. So that's what I mean accelerated. But it's from September to September, just work the entire time. So
Okay, and that's fascinating that you got to do a lot of different like writing styles. I feel like that's something that a lot of people don't get experience doing, being able to write to different audiences, or to evoke like different emotions, or whatever the case might be. There, so that's something that people can take away a tip from. Okay, there are different ways I can write things and put it out there, and there are different ways I can learn about this. So I wanted to give you a little space to just talk about your dissertation, the medical cannabis and older people. Like, I don't know if you want just like a summary, or like any big takeaways from that, or however you'd like to talk about it.
yeah, no, so I do hope to push the project a little bit further eventually.
Mm-hmm.
Obviously life kind of takes over, but during the entire project, I kind of approached it in a way that, as a person as well with a fibromyalgia, I've had it since very young. I am very young. So I realized, I was like, I'm being pushed sometimes on like really heavy like painkillers and stuff. And I'm like, I always told my doctor, I was like, by the age of 45, I won't have a liver. Like, you know what I mean? So what can I use as an alternative treatment? And so I started taking medicinal cannabis whenever I have pain, just to manage it. And I realized that I was like, a lot of these geriatric conditions, you have to be on like heavy pain medication and stuff like that. So at first I wanted to do it on palliative care patients, and looking at cannabis as a use for it, instead of using morphine or really heavy painkillers. But then I was like, okay, it gets really sensitive when you look at the population, where you're going to get the information from. There's not a lot of information, the restrictions. So I decided to look at overall, and seeing the success of aging, the healthy aging, and looking at the ways in which cannabis can actually help people to go back to somewhat of a normal life while battling their conditions, in order to increase healthy aging. Healthy aging, or successful aging, would mean, you're working in your prime, and having pension, instead of just being sitting down on, like, not being able to be part of the labor market, and also just being able to do your normal activities. And throughout that entire research project, I did a critical literature review, looking at certain conditions. So the conditions I looked at were cancer, the benefits of cannabis for cancer, the benefits of cannabis for pain, and also the benefits of cancer for diabetes. And the reason I picked those 3 conditions were because they're one of the more common non-communicable diseases that are plaguing older adults, especially within the Western world. And I guess in terms of our results, I will say personally that it is beneficial. It has been found that it can actually help to, cannabis is a regulator in terms of cannabinoids, or a regulator, and they help to put your body in I forgot the homeostasis. There we go. That's the word. Homeostasis, in terms of helping with pain, and actually does not affect your body the way that pharmaceutical drugs will. And it has more benefits to it, especially when you look at like the chlorophyll, etc., depending on how you're taking it. So I guess my main takeaway is that there should be more of a push towards medicinal cannabis, especially in medical spaces, as a point of medication, as a point of therapeutical usage. And I'm looking to explore that even more eventually, in terms of clinical trials. But there are some clinical trials that have actually shown within the last year or so, especially from Israel, that can definitely support the stuff that I've written in. So hopefully I get it published, and hopefully get it done soon so you guys can read about it. But yeah.
Yeah, absolutely. I look forward to that. And it's crazy because there's a lot of like cannabis literature out of Israel, but because it's out of Israel, a lot of people discredit it. But Israel does a lot of great things. Like right now with the COVID-19 vaccine, they are killing it
Yep.
compared to a lot of places. But yeah. Did you like what? How many papers did you have to like research to do this? And did you focus on any specific older population like North America, or was it just like broadly around the world?
So because at the time research was really limited, well, not really limited, but yeah, I had to be careful of how I said it. And sometimes the population, so I think I read over 500, well, skimmed through most of it, but I used for my dissertation, if I'm not mistaken, I used about 100 different
Mm-hmm.
articles or more. I've read through hundreds of articles, like hundreds of articles. And a lot of them were from Israel. Like a lot of them were Israel, because Israel is a leading medical cannabis researchers ever. And gratefully, at the time, I was working part time with a cannabis company, the cannabis consultancy company, and I was grateful enough to meet a lot of the researchers in Israel myself, or a lot of lead researchers in cannabinoid therapies across the world. So having those people in front of you when you're reading their articles, it is so different, where you're just asking them actually these legitimate questions. Though you cannot put in your research, it informs your research and the ways you look at it. So I think that was a benefit also of being in England. It was that, it was a booming industry at the time, and it still is. But at the same time, I was like facing these people in Israel, and I was like, oh my God, this is so cool. Like, how did you do this? And what would your advice be for me who's writing it? Um, and when I was doing my research, I kept it very broad. I really did want to focus on like a certain like older adult population, but the research didn't allow me to, so I had to broaden it to saying, okay, well, 16 over. That was my main restriction, was 16 over, just because that was like the golden number across the world when it came to aging. Like I know Canada is like 65 and older, they consider older adults.
Mm-hmm.
While I think in England, it's about 64, 60. It really depends. So I just kind of just left it at 60 because it was a great starting point um, for older adults. But again, like when you pick a topic for your dissertation, especially like something like this, you have to be very open. And I guess that's also another limitation to your research study, because as much as you want to like target it as much as possible and be specific, it's very hard, especially when you're dealing with political restrictions of like, you can't like, THC, for example, is a cannabinoid in cannabis that's, prohibited in England, while CBD, which is another one, is not. So there was more research on CBD rather than THC. So that was another restriction. And then, UN and WHO. So it was a lot, but you have to kind of do what you can. And that's why I said I want to continue doing the research, because now I'm back in Canada, cannabis is legal. So you can kind of play with the cannabinoids as much as possible.
Okay, yeah, that's awesome, and I hope that there is like at least in the US's case, they open up more research to cannabis and stuff, because it literally is illegal because Mexicans used to smoke it, and they wanted to make it illegal so they can arrest the Mexicans and stuff like that, and there's a lot of racist history in that. with the Black population also, but we're not going to get into that today.
We can get into another time though. Don't worry, I'll
Oh,
give you a full list.
oh, we can definitely do that. I look forward to that actually. So after you graduated with your Master's of Science in Gerontology, you became a health policy analyst with Sioux Lookout First Nations Health Authority. So how did you come across this? I guess coming from England, like how were you like searching for jobs, and yeah, tell me about that process.
Yeah, no. So unfortunately, with COVID, I was staying in England. I was working with London Canada Group as a conference manager slash project manager, really. And COVID happened. I came back to Canada. I was doing some consultancy work as well, and then I came across this posting for a health policy analyst with Sioux Lookout. So Sioux Lookout, in terms of like you looking at location, it's about, if I'm not mistaken, 19 hours away from where I work, from Sioux Lookout, from Toronto.
It's
So
like south, right? It's like South Canada, is it?
no, it's northern, so it's all the way near like Hudson Bay, like
Okay.
all the way up there. Yeah.
Okay.
And I work right now there. I work on the COVID regional response team in the planning section. And what we do there is really working on rapid testing, rolling out vaccines, like COVID vaccines for the First Nations populations. There we overlook over 30, I think 31 to 33 different First Nations communities up there. So it's really, really cool to learn so much more about another population that has a very, very, rich history with Canada. And I say rich in air quotations, but I feel like there's a lot of parallels between the Black community and the Indigenous communities, but it's always been a learning experience for me. And, going in and looking at ways we can definitely give them the autonomy to speak, but at the same time be a health policy and help them with their population in terms of isolation, because being so far away, they're very isolated. And you're trying to protect the communities with COVID. And also through this entire implementation of working with different stakeholders, you're also learning that these programs can also be in place for other viruses and other communicable diseases that are plaguing their populations as well.
Yeah, and I think that that's one of the big things that I feel like people aren't talking about either, is like the systems that we need to keep in place for the next COVID-19
Yeah.
and things like that hit. So yeah. Are there like any big challenges that you're facing that you'd like to talk about?
I guess the biggest challenge sometimes is having to sit down and saying, you take over. So I'm very much about learning and wanting to advocate for people, but at the same time, you have to learn when to step back and really be an accomplished slash ally, allowing them and giving them the empowerment. It's about confidence and making sure that they're always in the conversation. So I find myself now in meetings with chiefs and tribal councils and trying to understand their social political structures as well. So I'm constantly learning, and I'm constantly trying to understand even their language. Like, even I find it very difficult sometimes to even pronounce a lot of their names, but it's been such an eye-opening experience to see the how they spearheaded their own community in terms of really regaining or attempting, or throughout the entire process of just like saying, this is what we need, this is what we deserve, and this is what we want from the government, and this is what we're going to get from the government, and this is how we're going to do it, and this is how you're going to help me do it. You're not going to do it for me, we're going to do it for ourselves. And I bring that back to my community, and I'm like, well, guess what? This is how we're supposed to be doing it too. So yeah.
Yeah, I agree with that. I agree with that. But I really appreciate you saying that, because I feel like it is definitely a learning experience, especially when you're working with like First Nations or just vulnerable populations who haven't had the chance to be at the table. For the most part, it's just great to learn and engage, and I feel like both parties should look at that as a learning opportunity and really treasure the relationship as well as just building those bridges.
Oh yeah.
So thank you. So you are, after that, you were a health and social policy researcher at DiversityTalk. So how do you come across this position?
So DiversityTalk is my consultancy. It's my brand. It's my business. This is what I do. Um, So I started Diversity Talk when I actually, I started Diversity Talk just because there needed to be more things that are happening when it came to cannabis specifically, but also when it came to healthcare, which
Mhm.
are my two passions. Within the cannabis space, we all know it's not as diverse as we were like, slowly touching upon. And I advocate for it. But throughout that time, I was given, people were messaging me saying, oh my God, like I'm hearing you talk and you're, you saying it, girl, you doing it. And I'm just like, okay. And they're like, yeah, but can we use you? Like, we know we're working on projects and we need somebody. And I was like, oh, so there's a gap. Okay. And I could definitely feel it because I'm educated, I have the background and I know what I'm talking about.
Mhm.
And then that's how I started my brand, Diversity Talk. So, it's a platform to engage minorities into the space as well as educating them in spaces of cannabis as well as healthcare. And it expands really. And throughout that entire process, I've been, acting as a project manager, working with the city of Toronto. In that I also work with Ontario and I work with different stakeholders. I also do like a lot of projects in terms of, like social determinants of health for Black Canadians. I'll do report writing. And right now I'm working with the Black Scientists Task Force on Vaccine Equity with the City of Toronto in partnership with them, just to really, bring forth the, education and answering the questions for our community and really addressing the mistrust that we have with, the government and science, which is very warranted, depending, based on our history with the government, etc. So that is what I work with as well. A lot of the projects that I get are very varied. So I get some work in cannabis and sometimes I get work in public health. But equally, it's very much an opportunity where I can get to stretch my wings. I meet a lot of people. I host events, like one that's upcoming right now, which is the Black Canadian Cannabis webinar on February the 25th. There's a plug. Um, but like, I get to work with so many different things, doing events. I love doing events so much. So like, like I was trying to host a cannabis yoga event last year. And like, now I'm doing vaccine hesitancy, stuff. So it pulls me in different areas, but it's ultimately been a hard road to run your own consultancy and to be an entrepreneur while still being a researcher, which is a lot of work as well. So yeah.
Yeah. So how do you balance that?
I don't. I'm joking. I do.
No. Well,
I do.
it's a fair answer if you don't.
Sometimes I feel like I have it under control, and then I look at my calendar and I'm like overbooked. But I feel like when you know this is what you want to do, and when you find that this is your passion, and nothing stops you. Like, sometimes I'm running 16, 18-hour days just doing work and like, back to back to back to back meetings, and you just kind of get to a point where you're like, why am I doing this again? And then you realize and you read like the paper and you're like, this is why I'm doing it. Like this is why I'm doing it. This will benefit someone, and even seeing it benefit someone. So that's how I manage it, is just, knowing that the outcome is going to be something desirable. Um, and my calendar. That's about it.
Awesome. And I think it's important to have like that why, because if you don't, then you just give up on something. So that's definitely important. So you touched on you having like a bunch of different clients from all over. So like talk to me about how you got those clients. Talk to me about how you got your first client and then how you got all these other clients.
So okay, this is a funny story. I got my first client from an interview I flunked.
Mm.
So I had an interview and I did not do well at all. Like I was so embarrassed after I hung up on that call. I was so embarrassed. I was like, oh, I messed up. And the lady that was interviewing me, she was the executive director. And she contacted me and she was like, you weren't perfect for the position, but I was so inspired by some of the things you said and the work that you've done at your age. And I was like, okay. At this point, I'm still embarrassed because I was like, I was like, I messed up. And Yeah. And then she was like, well, she knows someone that's working on a project and she thinks that I would be a great person to work on as a researcher. And I was like, okay. So then I ended up doing the research project, which was investigating the social determinants of health for Black Canadians specifically. And I took the approach of actually not looking at the typical social determinants. I did, but I looked at what was actually affecting our Black population, like out of the entire like list of 18, for example.
Mhm.
And I was given a turnover time of almost 3 days, which sounds impossible when you're trying to do a project like that. And again, something I was very passionate about. I did my all and I put it out there and I sent it to him. And ever since, he was like, oh my God, you need to know about Ika. Like, she could do this, she could do that. And, at the time, I'm like, this is like, I submitted it and I saw errors, like grammatical errors. And I was like, oh my God. But then, when you have that repertoire with someone and you keep talking to them and you have that and, they realize your passion. And I always stress, like, it's one of those things, like, if you know what you're good at, use it, do it. Don't, like, you can work on your weaknesses and work on them, but just make sure you're good at what you do. And from that, it was just kind of like word of mouth, word of mouth. And then I was also doing events where I was speaking on a panel, or I actually wrote an article that was self-published on the cannabis industry, calling them out for not being advocating for Black Lives Matter at the time where George Floyd died. And it picked up steam within the cannabis space. It was being republished. It was, doing so much. And it was through that people started reaching out to me as well and using my Instagram to really talk and, delivering information and working within my community and the stuff that I've been doing. So everything kind of pieced together and I started really branding myself, like branding who I am as a person, and realizing that there were opportunities, that sometimes you have to make your own opportunities. And just like you're branding yourself, you're doing your thing, right? And you're going to get opportunities and you're going to meet people who are going to be like, wait, I know somebody that can do this for you. And that's how the word of mouth goes, right? And your work speaks for itself. So, as much as you may not want to do that report or do that thing, like, just make sure you're doing it and you do the best as possible, because that's the last thing that lasts in people's minds when they want to hire somebody.
Okay, yeah, thank you for sharing that. So you said that you were on a couple panels and stuff like that. How did you get onto those panels initially? Did you have to request that, or did people request for you to get on those panels?
um so after my article dropped, I ended up getting media interviews because someone in the industry had known media contacts.
Mm.
And then from there, the people heard me speaking, and then started calling on to me to do certain things because they realized that I was going to speak on it, doesn't matter what, and I don't care. Well, I do care, but I'm gonna call it out.
Mhm.
And I had a unique voice at the time that didn't sound like everybody else when it came to equity and stuff like that. So some of them I actually do know the people who have put them together. Other times, I've just reached out and said, listen, I'm going to be at your events anyways, but if you're looking for somebody to speak, then I'm down to speak. And I've gone on panels that way. But it's really about networking. I can't stress that enough. It's about networking. It's who you know sometimes that will get you to these things.
Absolutely. And then talk to me a little bit about, like, you spoke about brand. So talk to me about how you thought about building this brand and like putting it out there.
Um, I guess I was like, okay, what do other people do? How are they getting this? Like, what are they doing? So I figured, okay, I need to get a logo. Period. Well, at first I need to get a name. What am I doing? Kind of stretching out like a business plan. Like, what do I anticipate my business to be like within 6 months, a year, 5 years, 10 years? Like, what do I want? Getting a name that made sense to me, which was Diversity Talk, because not only am I talking about diversity, but the topics that I talk on are very diverse and I love to talk. So putting all that together, I came up with a name, I came up with my logo, I came up with a website that I did myself, and just learning the entirety of business. Really, it was like, okay, how do you start a business, and branding yourself, looking at social media and seeing the ways that people use social media, and how it was aligned with what I wanted to do. I also did LinkedIn and making sure that my LinkedIn looked appropriate, that it looked like a business LinkedIn in terms of when people look at me, like what do they see? Who are they trying to hire if they're looking for a consultant was another thing as well. What is my image going to look like as well? Like, going through SEO and all those different things. So it isn't just something that's like, boom, I'm a consultant today. This is my brand. This is what I do. This is my services. No, this is an entire business that you're building for yourself that needs to be sustainable. So
Yeah, awesome, awesome. So did you actually like visualize 5 to 10 years out, like what you would be thinking?
yeah.
Yeah. Okay, that's awesome.
Yeah. I'm almost there. No, I'm joking.
I don't know if you want to share that vision or just a part of it.
Yeah, no. So I see myself actually having a team of people like myself that can actually advise different organizations on policy, on project management. So, as I get more contracts and sometimes I can't handle it, I have subcontractors that I work with that can actually help me because it's getting to the point where like I feel sometimes overwhelmed. And that's what I see myself in 5 years is definitely having consultancy where, if you need a project management in healthcare, call on me and I can definitely get you somebody or I can work on the project myself. And I see that also bridging back to the UK. I see it bridging back to Jamaica and the Caribbean as well in terms of my efforts for, health equity.
Yeah, global. Love it, love it. How can someone or how do you look for subcontractors? And if someone wanted to be a subcontractor for you, are you like, could they just reach out to you, or how would that work?
Yeah, please reach out to me. Like if you that's another plug. Please reach out to me. I probably have some work for you to do that you can help me with. But yeah, no. I In terms of subcontractors, I look for people who have project management, especially because that's where my main work is. Anyone who can do good report writing, anyone that's really good at just taking over certain aspects of the work I do. Those are the type of people I usually call on. So, like my subcontractors now, one person's really good at event management, and as I'm doing events and town halls, I know that she would be able to step into my place and really help me with that stuff. So.
Yeah, that's awesome. And that's something like I reached out to, like, well, some students reached out to me and they're asking me like, how can I get him? I was like, reach out to a bunch of different public health consultants. They're gonna have some sort of work. Someone's gonna have work for you to do. So just reach out to a bunch of people, and especially with like LinkedIn and Instagram now, there's just so many of them online. So that's awesome. Thank you for sharing that. Uh, So before we move on to your next position, I just wanted you to talk a little bit about the webinar that you said you're hosting on the 25th, I think it was.
Yeah.
What would someone get from coming to the webinar?
Yeah, no. So with this webinar, there's about a lot of emphasis on Black American cannabis world. What's happening in the UK and in the US, and there's not a focus on the actual Black Canadians that are actually doing and spearheading and trailblazing within Canada.
Mhm.
So I wanted to celebrate them as it is Black History Month, but I also wanted to give them a space to speak because a lot of them don't get on these panels. And I wanted that opportunity. So I'm breaking down the event into 4 different sections. Health and wellness, which is going to talk about the benefits of cannabis and the benefits of where we can be when it comes to cannabis education for Black populations. As well as we're talking about economic barriers. So a lot of the people that are on the panel are people that are like the first Black woman to own a dispensary, cannabis dispensary, the first Black woman to have a cannabis license, cultivation license. We're looking at Black entrepreneurs within the space and how did they get there? Like, where was the money? Like, how were you able to access and navigate a space that's really not designed for us per se? And then we're also looking at what Black women and intersectionality in the space as well. So looking at the Black women all again in the space, the ones that are advocating, the ones that are grassroots, and then the other one is also social justice and like what needs to be in place in order to help BIPOC, which is Black, Indigenous, and people of color, in the spaces in order for them to be able to get their records expunged and moving forward, going from a legal, like a legacy market all the way to a legal market. So that's what I'm expecting from that panel. And I can definitely say there are a lot of people that I actually met throughout the way that have been so inspirational that I didn't know existed. And I was like, this is a shame. People could really benefit from hearing your stories. So
And where can people register?
Eventbrite. So you can go to Black BLK cannabis.eventbrite.ca.
Okay, thank you. So definitely tune into that, everyone. Okay, so after, well, not after this role, since this is your role currently. So you have another role as a project manager at Racialized Health Initiative. So how did you come across this role, and then what do you do in it?
Yeah, so one of my many hats that I wear is I am the communication and marketing manager for Sickle Cell Awareness Group of Ontario. I've been volunteering with them since my undergrad, I think it was second year undergrad, and so it's been about 7 years now since I've been volunteering with them. And throughout that entire process, my mentor, Miss Lana Ray, who is also the president, she when you look her up, she has done it all for sickle cell. Like she has been one of the pioneers in terms of getting things done for policy and stuff. And she's started saying like, there's no racialized, racialized health initiatives are underfunded, and there's not a lot of support from the government, and it's a constant advocacy thing with the government in order to get things, even for sickle cell disease. And she decided that we're going to put a working group together, and Ika, would you like to be one of the project managers? And I was like, yes. I was like, why are we even asking this? Like, put my name down. So we started, and we're working with a group of about, I think, 8 different organizations across Ontario, if I'm not mistaken. We put together a proposal for the Ontario Health, but we're hoping to make an actual office within Ontario, the provincial government, in order to address racialized communities as much as possible.
Okay, awesome. And you also have like two certificates that you're working on, or you currently have them?
So one of them from Harvard, it was just a really quick certificate program that they had online. I was bored during COVID because I couldn't, I was jobless. I ain't gonna lie. We were unemployed. So I was like, okay, let's do something useful. Especially because a lot of people don't know what gerontology is here. Like it's not really a common thing. So I was like, okay, so I need something to back it up. So Harvard was doing those programs, and I just, did one. It went really, really well. It was on the global health and equity, on quality of care and safety as well. And I found it was really good. And then I was like, okay, so I'm still unemployed. Let me do Ryerson. And it was covered by OSAP as well. So I did the Ryerson program, and within that, I started doing my project management stuff, because project management was a coursework. And now I'm going to do my PMP, which is my professional my
Project
professional
manage no
project management. Yeah.
project
Management
professional.
professional. There we go. Yeah, with PMI, because I needed the coursework. So I'm currently working still on the Ryerson degree. It's just that obviously life and all the hats that I wear doesn't allow me to really finish it right now. But I found that it was really good in terms of reinforcing the stuff that I missed, just taking a gerontology program, because it was focused on public health, but it was more focused on the sociological aspects of aging as well.
Okay, and how involved have those certificate programs been?
Extremely. Well, no, I mean, Harvard wasn't that involved, but like the Ryerson one is definitely like a course, like it's an actual program. Like I was in university again, which I never really enjoyed. So, so I was sitting there, I was like, oh my goodness, I have assignments and essays and group projects. Oh gosh. But the Harvard one was very, very like straightforward. It was all online. The professors teach, you take your exams and stuff like that. So I definitely like recommend, if it's still available, to take it. It was great. I learned so much, especially because the people that they used to teach was like world renowned public health professionals that were doing work. So
Okay, and you also mentioned OSAP. I'm familiar with OSAP just because my ex-school friend is Canadian. But would you just like to talk about OSAP a bit and how that helped you with because you said it paid for the certificate, right?
Yeah, so with Ryerson has an Ryerson University in Toronto, by the way, has a continuing education program. These are for mature students or just people who are within professional that want to get like a certificate. And the province of Ontario has a financial support system. I don't remember what OSAP stands for. Ontario Support Association Program. Sorry, and it's that program that I actually chose, which was a health studies program, is actually covered, or some of it is covered by OSAP. So I just applied, and with the school's help, I was able to get some funding in order to get to do my program. And it was really good because it covered all of my fees. Um, and yeah, it was continual education as well, which was it was really interesting to me because I know they have it for like undergrad and graduate school and medical school, but I didn't know for continuing education they had financial support as well.
Okay, yeah, that's really dope actually, because I do not think there are any similar equivalents in the US. So that's pretty sad, but that's dope for you Canadians in Ontario. So moving on, where would you like to see yourself in the future?
At WHO. And I'm just gonna put it out there. I'm manifesting
Mhm.
it.
Okay.
Yeah, no. I do see myself completing my PhD, so hopefully I get in soon, guys. Pray for me.
Mhm.
Um, but yeah, I plan on doing my PhD. I would like to do it in public health focused, and specifically on healthcare management. Just because that's my forte right now. I feel like I'm really focused on that. And I also see myself working on a global level in different areas of like, aging and looking at older adults, but definitely being somebody who's a researcher, but at the same time, very applied in the work that I do. So hopefully you
Okay.
guys catch me at the WHO.
Yeah, definitely. We look out to seeing you at WHO, and good luck getting into your PhD program.
Thank
Um,
you.
yeah, you're most welcome. So, are you thinking more of like creating health systems focused on gerontology and that kind of thing?
Everywhere. Yeah, hell yeah. But I guess my focus right now is really on priority populations that I find as a priority, as well as researchers find as priority because
Mhm.
they're the most vulnerable. So that's where I definitely see myself like building out programs to really protect people and to protect their well-being and increasing their quality of life. So working on stuff like HIV, for example, within certain populations and education and informing proper decisions, and that's what I really want to look at is how do we inform better decisions, to better programs. And I guess that's where my project management background can really help me in as well. So
Okay, awesome. Thank you for sharing that. So moving on to the last part of the show, the Furious Five, the 5 questions I ask all guests.
okay,
Number one, what advice would you give to a student trying to pursue a career in public health?
be open-minded. Yeah.
Love it, love it, love it. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Have a resume that's ready and don't be afraid to send over 50, 100 different emails to these people and just introduce yourself as well. Like even if they don't have if they're not accepting people, just still reach out to the hiring managers and say, hey, this is my resume, this is who I am. Hopefully we can connect. If there's any opportunities, let me know.
Absolutely, that's great advice. Number three, what's something you're working on improving in your life right now?
Time management.
Fair enough. And number four, professionally, do you recommend anything?
I recommend that you focus on what you want people to see you as in terms of your brand and who you are as a person. What's your first impression going to be looking like?
Absolutely. And then last but not least, where can people connect with you?
LinkedIn, Ika Washington, as well as my Instagram, Ika.washi, and my Twitter as well, Ika the Tweeter.
I get the Twitter. I like that one. I like that one. Well, thank you so much for coming on the show today, Aika. I appreciate all your insights. I'm glad that we get to have this conversation, and I'm definitely going to follow back up with you to talk about cannabis and the racialized history or whatever the case might be. We can figure something out. So, thank you for your time, and I appreciate the insights.
Well, thank you for having me. And I'm so proud of you and everything that you've been able to do and accomplish. So please, I'm not a stranger. You already know that. So just, congrats, and thank you so much.
Thank
Appreciate it.
you. I appreciate that. I really enjoyed talking with Ika, and I look forward to following back up with her in that conversation. So you all be on the lookout for that. Be sure to register for her event on the 25th. It's definitely going to be great. Or just log in and tune into what she's doing so you could connect for other events. I know there's a lot of great value in this episode, and I hope that everyone's doing well. Lastly, just subscribe, leave a like, leave a review, share it with a friend. I appreciate you all for tuning in, and I hope that everyone stays well. Talk to you soon. Public Health Millennial out.